Isolation, quarantine, social distancing, these are terms we don't normally use, but they're on the tip of everyone's tongue now. The prospect of an extended period at home alone can be daunting. Not just boredom, but real anxiety is something a lot of us have to deal with every day. We wanted some help and some advice. And NMIF senior producer Matt Grubbs asked two psychiatrists from the University of New Mexico's Health Sciences Center to talk about what to expect and how to stay healthy while staying at home.
We have an appointment that I think a lot of people would like to have. We have two psychiatrists from the University of New Mexico. Dr. Caroline Bonham is an adult psychiatrist who teaches and works at the University of New Mexico, and Dr. Amy Rouse is a child and adolescent psychiatrist. Excuse me, I told you I was going to do that. But you also teach at the university. Let's start with the uncertainty of these times. Uncertainty, lack of control, I am certain that can cause anxiety. Are you seeing that right now?
Yeah, we do know that uncertainty and, like you say, a lack of control can increase distress, so it can contribute to anxiety and depression. We also know that there's a lot of proactive steps that we can take to help have a little bit of control in our life, and then also to reduce the anxiety that we're feeling.
What are some of those steps?
A lot of it is actually really thinking about the structure of our lives, too. As things are rapidly changing, it's really helpful to have routine and structure. Things like getting outside, getting some fresh air, getting exercise, sort of planning your day and quickly coming up with some new routines.
Yeah, that's certainly something, Amy. For adults, that's going to work. For kids, it's going to school. As I think to Instagram, when I looked at it, the first thing today, one of the things I saw was a post from a friend who's a mom. It was a schedule, something to do exactly what Dr. Bonham was talking about, creating that sort of sense of certainty. How do kids do with that?
So we know that kids are very sensitive to changes in routine, and this is, of course, a huge change for our kids here that are no longer in school. So I love the idea, like you're saying, of a mom creating a schedule, letting kids know what to expect for the day while they're not in school with that extra structure, because we can create that for ourselves, like Dr. Bonham was saying. And then we have the choice to, maybe with consultation with our family members, spouse, roommates, whoever it is, to change the routine and do something different. But once it's in place, then you have the liberty to kind of play with it, and that's a way to set up some more certainty in your life.
Increasingly, we are all being asked to stay home as much as possible. That's going to be closer interaction with family members than most of us have in our normal week. How do we deal with the communication issues that are going to arise, do you think?
We also know that that in any way, when we're having distress and when there's been kind of worldwide changes, that connecting to others is really important and really protective. So being kind to others, service to others, taking care of others actually really helps our own emotional health. So looking at these opportunities to be, again, connecting to both your family that you're in the house with perhaps, but also reaching out by telephone or text to neighbors and people that you regularly have contact who may be by themselves.
This will be a new practice, I think, for a lot of people. How do you just make those inroads? Is it as simple as just a text or a call saying how you doing?
Those are huge. Those are huge. And I know I've personally had people reach out to me and said, hey, how are you doing? Just a really couple of times, and it makes you feel better.
Sure. Dr. Rouse, how do we explain this to our kids or our nieces, nephews? How do we tell them what's happening?
So I think you want to first follow the kid's lead. As parents, you know your kid the best, and you know what their behaviors and signs mean for them. So some kids will be ready and wanting to talk about it more than others. And of course, you're not going to say the same thing to your 3-year-old that you would to your 13-year-old. So really tailoring it to the age of the kid, their developmental level, and what they want.
Can you give me an example? If a child is sort of being standoffish or doesn't understand, hey, this is spring break, I was supposed to be, somewhere else. How do you broach that and explain to them how serious this is?
Sure. So you want to create an open environment and letting kids know, letting teens know that it's okay to be upset. It's also okay to be a little angry and disappointed that you're not on the spring break that you wanted. It is a big change, and I think it's important for parents to acknowledge that. And if they are, you're seeing younger kids, you might see more of a behavior change than them being able to verbalize the emotions that they're having. So again, it's asking questions, but really don't harp on it if it seems like your kid's just not wanting to talk about it. So give them the space and then back off.
Those nonverbal cues, I would imagine, are very important.
Yes.
Being able to pick up on them, does this look like tantrums? Does it look like crying? What is that? How does it manifest itself?
So that could, well, again, be different based on how old the kid is, and it wouldn't be entirely uncommon to see some regression. So see some kids acting like they did maybe a year or two ago, because this is a time of change and uncertainty. And so again, as a parent, you get to know what to expect from your kid, and being tuned into the change, I think, is really important.
As a mother, I have 3 teenagers, and what I found helpful was talking with each one of them individually. They all reacted very, very differently, as they're different people. And I asked each one of them, on a scale from 0 to 10, how worried are you about this? And they gave me very, very different answers. And so just like Dr. Rouse is saying, I was able to then to tailor the conversation to kind of where they were and what was going through their mind.
And asking them individually how worried they were. Mm-hmm. That's pretty interesting. But it was productive for you.
It was very helpful. My son, and he gave me permission to share, was 0 out of 10, had no worries. And so I was able to talk about why I was taking it seriously and have a different conversation from my daughter who had more worries. And then we talked about ways to help her with those worries.
New Mexico has a lot of families that are very tight-knit intergenerationally. So why can't I see grandma and grandpa? Right. I'm certain is a question that many will get. Any thoughts about broaching that subject?
Sure. So I think giving the facts and being as honest as possible. You want to reassure, but you don't want to promise something that you can't keep. And in this time where things are changing rapidly, it might be difficult to want to give those promises. Again, sticking to the facts and using reputable sources online. There's a lot of information from the CDC that's written in accessible terms that you might use with your kids. But again, just being as honest as possible, even though it's hard.
We all have phones, computers, pads, tablets, all those things. Information is incredibly accessible. And that can be scary. There can be an overload. Do you have any advice on how to manage the flow of that information and the desire to know with what's going on, with all of a sudden realizing, oh man, I've been listening to the news for 3 hours now?
Right. And as you're describing, it's a really delicate balance, because we know actually having enough information can actually help with some of that anxiety and worry, really knowing what's going on and what's reality-based. Whereas too much information can feed those worries. So a lot of the strategies we recommend too is sometimes noticing yourself, am I feeling worse after listening to the news, or am I feeling more reassured? And then moderating accordingly. So if you're feeling worse, maybe cutting back to checking the news once or twice a day. Whereas if it's helping you feel better, that's a good cue. We also really recommend going to some well-validated sites. The New Mexico Department of Health has a wonderful site about local information, what's happening in our state, as well as the CDC and the WHO.
If the anxiety is building for people and they're feeling like, oh, I can't eat this meal because it's part of my stockpile or something like that, how do people manage that? What are some good methods for dealing with that anxiety?
I think it turns back to thinking about the things that you can control. And so making sure that you're eating the way you want, sleeping, keeping up with all of those daily habits to make sure that It is very tempting to go through your snack stockpile. I know that I bought some candy for me and my fiance as a treat, and it was all gone on the first day. So again, know yourself and know that it's okay you're not going to do it perfectly every time and do exactly what you want. There might be some over snacking, and that there are some things that you can decide to do differently.
One of the things that we've seen is this idea of isolation, quarantine. There are different terms for different levels. In San Francisco, we see people are allowed to go out, walk the dog, take a walk, that sort of thing. Maybe different than what we've seen from Italy, where there are impromptu balcony concerts, which, they have a lot of tambourines and accordions in Italy, don't they? But can people? Do you encourage them to get outside even if they're fearful of the spread of this virus? I mean, there are guidelines for how close we get to each other, as we're seeing here. But
and again, I would always defer to the New Mexico Department of Health about what we're recommending as a state. But what's nice about New Mexico is that we have a lot of open space. We have a lot of rural areas where we can go outside, get sunlight, be outside without being in contact with folks. And we live in a beautiful state too, so all of those are good, healthy activities right now.
And this can be something as simple as asking your kids to play outside, for their mental health, I'm sure, as well as parents.
Certainly, and if there's pets, getting your kids to take the pets outside. There's actually a lot of ways that we can connect to nature right now, and that's good for our mental health as well.
Okay. What about as we look at the economy? We go back to the flow of news. We all want to know what's happening, but there's going to be some tough news coming in these weeks. We're going to see businesses close indefinitely, some permanently. We think about family members, ourselves, as we deal with economic uncertainty. Most Americans don't have a stash that they can live on for very long. How do you deal with that anxiety?
I mean, these are really real issues, and we do know that lack of access to money, to housing, to food absolutely contribute to anxiety and depression, and we don't want to minimize those. And again, I think that bit about generosity and service to others and connecting to others as much as possible, that kind of coming together as a community to help each other is really important in our own well-being and then taking care of those that are around us.
And also being able to ask for help if we need it. So asking for help from neighbors, loved ones, or there are crisis access lines that are available. The New Mexico Crisis Access Line, NMCAL, is an option if you are feeling like the anxiety or depression or stress is just becoming overwhelming.
We can see impromptu sort of social networks forming around these sorts of things, and the idea of asking for help. In the times that I've done it, I recall it being very freeing, of saying like, okay, I just need a second. I need help. Do we do that enough?
We probably don't. And again, reminding yourself that asking for help is good, and then also giving help is really good too. So when you ask somebody for help, you're giving them the opportunity to reach out and to be generous.
Is there something to, if you have kids at home or just a partner or spouse, saying, hey, let's see what we can do for other folks, kind of forming that team, the quarantine, and kind of seeing if you can help someone?
Yeah, and I think remembering that what we're doing, social isolation, is for others, that is to keep our society as a whole safe, keep our most vulnerable people healthy, and so reminding yourself that some of these difficult things that you're already doing, which don't cost money necessarily, just to remove yourself more from social contact, is actually something that you're doing altruistically.
I would not blame someone if they were watching this and saying, this is ridiculous. I am just worried about me right now. Why should I be giving my money away? Why should I be donating to a food bank?
And absolutely, everyone is in a different situation. And so absolutely keep yourself safe. We do want to make sure that people do keep themselves safe and their families safe, and knowing what's right for them at each time.
How's this coming into practice for both of you as you see patients? Are they still coming into the clinic? Are you transitioning to telehealth? Where do we stand with that?
And so it's a little bit of both. And so we are UNM, we are continuing in-person visits. And then we're also transitioning to telehealth. We have been doing telehealth for over a decade. And so that's been a very effective way of delivering mental health care to rural communities in our state. And New Mexico, again, has a lot of infrastructure and has made a lot of policies and kind of advances in telehealth compared to other states too. So we're actually in a good position to be able to do this.
Been fairly aggressive, and it's important because we're a very rural state.
Mm-hmm.
Certainly, and it's some of the issues that are coming up for people. Again, everyone is different, but anxiety is definitely something that can be addressed by telehealth.
The way that New Mexico is, this rural nature of it, if you can't sort of walk next door, or is it just basically a phone call, finding the person who may need some checking in?
Phone calls are huge, absolutely. So absolutely, if reaching out to neighbors and friends, even if you don't walk next door, giving a ring on the phone is really important.
Certainly. Well, I want to thank both of you for coming in and sharing time. You've given us some resources. We'll put all those numbers and websites on our website so people can access it. Stay healthy.
Thank you.
Thank you.
Thanks.